Welcome everyone. Just as a quick aside before we start the video, if you're watching this broadcast in its live format, i.e. it's just been premiered, Sally and I will be online during the space of this broadcast. You can type your questions in the comment section and we'll make sure that we're responding to those at the time. If you're watching it at a later date, obviously still feel free to post your questions and we will get back to you, but there may be a slight delay with those. But for the period of this first initial premiere, we'll be online to answer your questions as well, to give it that live sort of feel. Without further ado, let's get into the video. Welcome MS translators. It is my privilege to be here, joined today by Dr. Sally Shaw, doing a slightly different Q&A to how we usually do them because of the interesting circumstances that we find ourselves in. And so recording this remotely at the moment. But today's Q&A, we're going to be talking about mental health for people living with MS, specifically during those interesting times that we're living through at the moment during the coronavirus or COVID-19 pandemic. And this Q&A really came about a result of the feedback that we received from you, our community, about your concerns that you have during this time. And off the back of this, we reached out to Sally, who we're incredibly excited and pleased that she was more than happy to give up her time today to participate in this. And I guess just to start with, Sally, we'll get you to introduce yourself. But before you do, I guess a really poignant way of explaining why this topic is so important and also why we're so happy to have you involved in it was during the promotion of this Q&A across our social media channels. We received a tweet in reply to it that just said, she wouldn't know it, but after seeing Sally at the MS Centre in Blackburn, she saved my life, literally. A wonderful human who genuinely understands the mental health complexities of MS patients. Forever grateful. So I think that I guess sums up why mental health is such a hugely important topic that we're talking about, and why we're really, as I said, excited to have you join us as an expert in the field to talk to us today, Sally. So maybe on that note, I might throw over to you just to introduce yourself for people at home who may not know you.
Thank you. And thank you so much for having me here, Brett, because I'm thrilled, even if we're not, in person in the same room, I'm thrilled to be here on Zoom with you. And I'm absolutely shocked and just amazed by that tweet, and thrilled that that person could contact you and tell them what a difference maybe a little bit of attention to their mental health could make in their life. And I think it was also a really great example of how you just never know how you can have an impact on someone, and might just be something that you've said or a kind word, or who knows, but that was a really lovely thing to pass on. So thank you very much for that. I am thrilled to be here. I'm thrilled to talk to anybody that wants to listen about mental health, particularly around mental health and the impacts having MS can have on that space, and vice versa. I guess just by way of introduction, my background is in science. I did a science degree, I did a postgrad in psychology, and then I decided to do a doctorate in health psychology, a professional doctorate in health psychology, because I've just always been interested in the interplay between physical health and psychological health, but I didn't really know exactly what I wanted to study. I just thought that area was fascinating. And then the uni was starting to press me for a particular topic, to narrow my field of research. What is it that you really want to look at here? And I had never considered chronic health to be an area that I would want to delve into. It's not a particularly exciting area if you're not in it. It's not particularly sexy, the idea of chronic health. But the day that I was diagnosed myself with MS, which was around the same time as the university was saying, hey, what are you going to look at? What are you going to research? Was the day I realized that actually MS can be very interesting. And if you're diagnosed with it, it suddenly becomes extremely interesting. So I did shape my research around that lived experience that I was having, which was around how people newly diagnosed cope with a diagnosis of MS in the first 12 months. I won't spend the whole time that we have together, Brett, talking about my research, which was now a long time ago, but essentially it told me something that I grew to learn very, very quickly, which is that everybody with MS is very, very different. And they are different in so many ways, not only who they were before their diagnosis of MS, but it's certainly how they manage this diagnosis in their lives and the coping strategies that they rely on to help them get through. So since that time, so I'll stop talking about me, but since that time, I've become a psychologist, and I've worked, at Eastern Health here in Victoria and in private practice. And I'm just always very interested to learn more and more about people with MS and their experiences.
Fantastic. I guess, you've already sort of touched on the first, so to let you know, and we've talked about this, I guess, in the lead up, we asked a number of people from our community to submit questions that they're interested in, as that's what we'd usually do with our live broadcasts. But I guess you've already touched on the first one nicely in that saying that people with MS are all different. And one of the questions that we had is, as people living with MS, we're all individuals and we have very different experiences. So considering that, are there really general strategies for mental health that can help us?
Yes, and I think it's a really good point, because we tend to lump people into boxes or into groups based on a particular label. And so when we say, what mental health strategies can people with MS use? Well, we need to be really aware that people with MS are people and they have MS. So firstly, they can use all of the mental health care strategies that are out there for anybody in the community. And so there are some basics and we're hearing some pretty good messages, I think, from government, from, on the ads, from great organizations like Beyond Blue or Lifeline. Everybody's putting in their 10 cents about how we should be looking after our mental health. And so I think it's important, and maybe we can look at that first. And there are a few kind of guidelines and strategies that everybody can use. And then maybe we can have a chat about why it might be particularly important for people with MS.
Yeah, definitely.
Given that label. Okay. So the main ones, and I don't want to spend the whole time on this because, as I say, there's lots of information out there already. But the main one that I like the most, which can help us across the board, is to just maintain that daily routine, a really health promoting daily routine and a weekly routine. And I think in this time of coronavirus, it's important for us, if our situation has changed and if we're spending a lot more time at home, which we are, to maintain a routine, not just across each day, but across the week as well. Today's a weekend. It should be different to a Monday or a Tuesday. We don't want the weekends to just blur in. I've seen some great memes that have said Monday, Tuesday, Wednesday, and the start of the word is crossed out. So it's just day, day, day. It just seems it's the same day over
feel
and
like
over.
that a lot. Yeah.
Right. So we want to avoid that. We want to make sure that weekends are still weekends, and hopefully something is happening on the weekend to look forward to, even if it's a sleep in. That's still something to look forward to, or a later than normal bedtime. That might be something that might be a highlight on the calendar at the moment. So a daily routine and a weekly routine is really important. And they should include things like exercise. If you were doing 6 spin classes at the gym before coronavirus, then that's going to be changing now. You're not going to the gym, but you want to keep up this kind of similar level of exercise in a creative way. If you're not somebody that loves going to the gym, I'm kind of in there, you've got to just move your body. And so any kind of ability, any way you can, just keep moving. It might just be walking around the backyard a few more times, or getting up and down those stairs a few more times, or just moving your body to music or to a YouTube exercise channel. Lots of different ways we can look at exercise. We also want to take care of some of the basic stuff. So it's a good idea to have a shower every day. If having a shower every day is really hard for you, or you need help, then maybe it's an every second day routine for you. But if you're able to have a shower before bed to feel really relaxed, or have a shower in the morning to start your day, to know that even though I might be staying home all day, I'm still up and I'm showering earlier rather than later to feel a sense of normalcy. We want to keep having our medication, and we want to continue to feel a sense of purpose. We want to continue to be able to have a few things to tick off the list where we feel like we've accomplished something each day. That's a really, I think, underestimated strategy. So just to be able to tick a box is a really important thing. And that routine is something that I think we can all pay a little bit more attention to, with coronavirus or without. But there are other strategies as well that are being floated in the media at the moment. And one of them is exactly that. It's about the media coverage, and it's about maybe just being mindful about how much media you're ingesting. And I guess media comes in so many forms now, but most commonly we look at how much news are we taking in, both across how many hours of the day, but also the sources of the news. And a good rule of thumb is to just choose one news outlet that you trust and limit your quantity. I saw a recent article that said less than 4 hours. I thought, wow, 4 hours is a lot. I would be suggesting maybe a little bit less than that. And I would be suggesting to really limit it before bed at night, particularly if you're having any kind of trouble sleeping. So it's just a little bit of news. I think the point can be made, and we don't know when people are going to view this recording, but the point that can be made is that our time is changing so rapidly. So 3 or 4 weeks ago, let's say mid-March to early April, the news was ever changing. You know, you could have a news bulletin in the morning and your world could be impacted differently by the afternoon. And that seemed to happen day after day for a week or two. It was very, very confronting and overwhelming, and there were always changes, and it was quite scary for a lot of people. Now at the moment, right today, and it could change tomorrow, but at the moment it seems as though you can turn on the news and hear the same message that you heard yesterday. So we need to question, do I need to turn on the news? Do I need to watch the bulletins 2 or 3 times today if they're actually just repeating what I already know? So it's just a good idea to be mindful about the amount of news we take in.
And I think
other ways, sorry, go ahead.
I mean, I think that what you're saying as well, and I think it ties in a little bit with the watching the news, is the importance of having something that you're looking to do every day and ticking off. Because I mean, I know even personally, watching the news, we're focused very much on when are we going to go back to, you know, when are these restrictions going to end? And so you become fixated on, you know, well, we just need to get through the next 3 weeks, or it's the next 3 months, or whatever it's going to be. And you forget to, you know, actually, I've got to do some stuff today, and I've got to do some stuff tomorrow. So I think that those are really important messages.
Yeah, that's right. To just bring it down to, and it is a day by day thing at the moment, even though our minds go to, will it be 3 weeks? Will it be 3 months? Will it be 3 years? When can I leave the country again? Like, it's so easy to just spiral quite quickly. Other strategies that are out there in the public domain at the moment that are good across the board for anybody include things like showing kindness, being compassionate to yourself as well as everybody else in the community and, you know, in your family. So really upping the level of kindness and care for others rather than just shrinking down to a smaller version of you, as well as engaging in joy. So actively engaging in joy and actively engaging in social engagement. And I think we'll probably touch on social isolation and engaging with others a little further down the track today. But it's about deciding how you want to spend your time, consciously with intent, and actively engaging in great health promoting strategies. Yeah.
Okay. And I think, well, I mean, I guess a lot of what we're talking there, and you say quite rightly, is that, you know, this situation is impacting the mental health of everyone.
Yes.
And, you know, we had an article that we showed maybe early last week before this, talking about, you know, Lifeline, I think on average at the moment are getting 700 calls a day, more than usual. People who are struggling through all of this. But I guess a question that's worth thinking about is there any reason why people with MS would be having a harder time coping with this than other people, say, in their families or in the broader community?
Yes. And I think it's a really interesting question, because I think it is more challenging for people with MS. And I want to go right back to when coronavirus was reported as something that was happening in China. And I think in Australia, I'm being very broad, very stereotypical, but there might have been a thought that crossed a lot of our minds, which was, oh, gee, that doesn't sound good, but it also, I think it's a bad cold. Like, I think it's a bit of a virus. And so we kind of warmed up to this idea of coronavirus, thinking it was just a virus that was becoming more of an issue in China, but it was so distant from us, we didn't give it a whole lot of attention, maybe. And then it hit Australia, and we were getting very clear messages from government and from medical professionals that were saying, you will not do well with the coronavirus if you are an older Australian, or if you are immunosuppressed, or if you have a chronic health condition. And that was a very clear message. And I think sometimes when people heard that message, it was a little bit of a kick to the guts, because so many of the MS medications fall into the realm of, this is an immunosuppressant. And so many people with MS know that they're on a drug that they can term an immunosuppressant. So then that point of uncertainty just ramped right up, and people with MS became very, very aware of, what does this mean for me? And I think that that's where the fear kind of started to creep in. And then we saw footage from Italy, from the UK, and then from America, where the numbers of people infected were getting higher and the numbers of deaths were getting higher, and the fear was real. And we were told to isolate, which is great, but it also increased that social isolation, not just the geographical isolation. And I think it was understandable for people with MS to feel that a little more acutely. But at the same time, some people with MS reported feeling a little bit more invisible. And I think, unfortunately, when the government made some pretty tough calls, and I thought some pretty great calls around economic stimulus packages for people that needed it, they certainly did that for a lot of the sectors of the community, like people on New Start maybe were given extra money in their pensions. People on the disability support pension were not. And I heard from a few people with MS that just thought, wow, like I'm invisible in this. I'm one of the most at risk and I'm not being supported. So there was this real sense of unease around financial security and personal safety and security as well.
Yeah, and I think that those, those feelings are really hard to deal with because, uncertainty is something that we talk about a lot. For people living with MS, that it is something that, day to day, you don't know how things are going to be happening. But when that's compounded by, something that we've seen that's really gone global and had such a huge impact, it's going to ramp up.
It will, and it just increases people's levels of anxiety and potentially their levels of depression. So, of course, that's where we link it right back into the mental health effects, because we know that it's been a more difficult time for people to process, and we know that mental health issues have increased. So they're almost two sides of the same coin, I guess. We can have difficulties processing information, and that's entirely normal, and we can have mental health effects that can be really disabling.
Okay. I guess that leads into, and we talked a little bit there about the social isolation and the support networks. Another question that we had submitted was, how do we cope with all of the changes and uncertainty when our support networks have been removed or changed? Where and how do we get our needs met?
Yes. And in fact, this question I know came from somebody who had spoken in their question. I believe this was one of the ones that you sent me, Brett, about they had referenced Maslow's hierarchy of needs, which is a great model, and we don't have to go right into the detail of it, but it was such a great way of framing this question and talking about how people with MS are processing this. So I think as a way of bringing the listener into Maslow's hierarchy of needs, we can run through how concerning different elements of the coronavirus have been for people with MS and what needs, I guess, it attacks. That's quite a dramatic way of saying it, but I think you go with me and hopefully we'll get our heads around it. I think the first thing that people with MS thought of, and people in the wider community as well, was their personal risk. Right, am I at risk of catching this? And as a secondary, what will the outcome be? If I get the coronavirus, I might be fine, I might not be fine, I'm immunosuppressed, what does this mean? So this is really attacking what Maslow would say would be one of our basic needs in safety. This is our safety need. This is around personal health issues. And we can drop very quickly into the next step of this, which is, what does this mean for my family and friends? If you may have older relatives, you might have people that fit into the other categories that the government said, watch out if you're older or if you're immunosuppressed. We're worried about those people as well. And so that is also an example of, the bottom of this pyramid where our basic needs really need to be met. There's a few that are crumbling a little here. And we can also look at when we're worried about ourselves and our friends and family, we're more likely to socially isolate, as we mentioned before. And that's fine, but it means that we're not going to be engaging in more of the things that provide us with our psychological needs being met. So it's around love and friendship. It's around having real connections with people. I've had lots of people that have talked to me about, sometimes I'll say to my clients, on Zoom at the moment, what's been the hardest thing for you at the moment? And if the person I'm speaking to is a grandparent, it is invariably, I don't get to see my grandkids. I don't get to touch them. I don't get to snuggle them. I don't get them laughing and toddling around and making messes. And I miss it so much. And Zoom's not the same when we're thinking about interacting with our grandchildren. It might be fine for a business meeting. It's really hard when you just want to play Play-Doh with your grandkids. So that's a basic need that we have as human beings, to be able to connect in a physical way. Mind you, as an aside, we are thinking that there could be an increase in pregnancies, COVID-19 babies, because people are home so much at the moment with the people that they love. So let's watch this space 9 months from now. But some of our needs around intimacy even, but certainly around love and friendship are really, it's lacking at the moment, and that's hard. If we look a little bit further, we might be looking at employment and financial needs, and sometimes they're not being met. The government are really trying hard to reassure people. They're giving us extra stimulus packages. They're saying, we need to make sure that the financial pressure is not going to bring us down psychologically as people and as community groups. So we can see that our needs, the government are attempting to attend to our needs on a variety of levels, and employment and finance is one. We're also looking at people with MS and people generally having a decreased sleep quality, and that's a basic need. We need rest as human beings. We need food and air, clean air and water and sleep. We need safety. We need to feel secure. All of these things are really being impacted in small or significant ways. And then the two larger ones that I wanted to finish this bit on were, we saw that pretty quickly our ability to interact in community pursuits changed dramatically. And I don't think anybody was really prepared for how that would look. The idea of closing things down, we thought, okay. But then you just see an example of it. So an example that I thought was quite poignant was when the AFL said, okay, we'll stop after round one, I think. I don't know if we got through the whole of round one, but part of it, you might know. And do you know?
I do know we did get through the whole of round one, but I prefer we didn't. But anyway.
Apologies. Commiserations to whoever you barrack for. Who is it, Brett? Tell us.
Everyone knows I'm a Carlton supporter, but that's...
Okay, apologies.
Yeah.
Okay, 2021, who knows?
Yeah,
Go, you. Yeah. I was surprised. I look back on it and realize it makes perfect sense, but I was surprised at the time to find out that there was such grief related to that. People really look forward to AFL season starting, and any season. We're looking at NRL at the moment, and everyone's trying to continue. But the devastation that really came from people not having something like sport to look forward to invest in, the collaborative, community support that they get, and they love working as a team or watching their team. I was aware of the grief that people experience at the end of the AFL season, but I wasn't expecting that it would happen, after round one. Nobody was, but there was clearly loss being felt, and that's not just footy, but it's across lots of things. And it might just be having a picnic in a park or catching up with friends on a monthly basis, which nobody ever thought was a real luxury until now we realize how much we miss it. And then one step further, when we look globally, I think people with MS are also aware, as is the rest of the population, that this could have massive impacts. We don't know. It's the uncertainty you touched on before. We don't know what's going to happen in the space of global economies and how that will impact on us and the people we love.
Okay. And I guess, part of it, and you touched on lots of different things there. I guess it's worthwhile people just acknowledging that these needs aren't being met, and that's whatever that need is for whatever person, that's okay. For me, as you say, for football season, for me,
I'm sorry, I feel your pain.
No.
Yeah.
on a personal level, that is something where I said, okay, this is, strangely, I feel that sense of this is something I really look forward to, and it's gone. And obviously with the bigger picture of things that are going on around the world, it's not a huge deal. But, on a personal level, being able to acknowledge whatever you are feeling about that is really important as well, not to try and minimize it, I guess.
Yeah, don't dismiss it. And you touch on a great point that I'm glad you did at the end there, because the top of Maslow's hierarchy of needs is known as self-actualization. And remembering that this model was put together in the 40s. So we've had a lot of discussion about it since, but it's still a great base to, explore. And that top of the pyramid, self-actualization, is around a human being's ability to find meaning and purpose. And I don't think you would put all of your meaning and purpose in the Carlton Football Club, but clearly there's a little bit of a fibre, some days depends.
Some people might
And
disagree,
so,
but yeah.
right, okay. So it is worthwhile noting that if you can't have your basic needs met, food, security, health, the ones at the bottom of the pyramid, it is postulated that it is almost impossible to have your meaning and purpose needs met at the top of the pyramid. So let's stop beating ourselves up if we're not able to find rhyme or reason or pursue the bigger picture stuff. You know, we should be using this lockdown time to be better people and to do amazing things. No, we should just be ticking boxes if we're eating well and we're sleeping regularly and we're able to have a shower every day. We should be high-fiving each other for just getting through it, really.
Yeah. Okay.
Yeah.
Fantastic. So I guess leading on to another question that we had submitted, and I guess this is looking at a slightly different one, because now this is talking about actually moving out of the self-isolation.
Yes.
So this was a question, firstly, thank you for doing the Q&A sessions. Find them incredibly informative, and we definitely need these facts during this unprecedented time. I'm living with MS, but I'm also a medical sales rep, so I spend a lot of time doing hospital visits. I'm currently working from home, but really worried about going back to work, as it's going to be a high risk environment. And I know that we won't have a vaccine available by then, and it's really taking a toll on my mental health. So I guess my question is, how do I manage the stress, and what are the things that we can do to best protect ourselves?
Yes, that's a big question, because I think this touches back on that great idea that everybody with MS is different. And also everybody with MS has a different assessment of risk. They have a different assessment of risk regarding their MS medication and what's, worthwhile taking the risk and symptom benefit, or side effect. They have a different take on risk in terms of contracting the coronavirus. They have a different perspective on risk around talking to their employers about what they feel comfortable with and what they don't. So I guess the person that's asked the question, I'm not sure whether they have already had a conversation with their employer about why they might not want to be going into a hospital setting. So I guess that changes things a little bit as to whether their employer knows or not. But I think it's very important for us all to focus on our own unique situation and to recognize that just because the person over there, they might have MS as well, they might even be on the same medication as me, but if they choose to do something that I don't choose to do, that's fine too, because we all have our own take on a situation, and we can all make our own decisions, and they're right decisions for us. So I think we should always talk to our medical professionals about where they see it appropriate, whether we go back to work or not. I mean, this person may have a neurologist that says, or a GP that says, you know what, I'd prefer you to be working from home. I think the risk is serious. Here's a medical certificate to suggest that we work from home, maybe not a medical certificate, I don't know the terminology, but a letter of support to say that it'd be better for you to work from home, or a doctor to talk you through the risks of whether it might be all right to go, given masks or gloves or however they want to set it up. I think ultimately the message is that we're our own best advocate. So I would love for that person and for anybody else to have a think about, what do they feel comfortable doing, and how do they put a voice to that? And then I think a very important part of this question is around realizing that making the decision today might not be helpful if nobody's asking this person to go back to work yet. So, if we think back 3 weeks ago, the world is or at least Australia is in a very different position to what we were 3 weeks ago. We don't know anything for sure yet, but we certainly know that we didn't go from bad to worse. At the moment, the last 3 weeks looks like it's gone the right way so far. So the conversation you'd have with your boss today would be very different to the conversation 3 weeks ago. So let's not presume to know what types of messages we want to be sending our boss in a week or two from now, when we don't know what the world looks like then. So I guess that point is, yes, if the conversation doesn't need to happen now, let's take a step back and say, I know that I have full capacity to make the best decision for me when the time comes.
I guess it comes a little bit back to that. We need to be focusing on our daily activities and not
Yes.
necessarily thinking about what's coming in 3 weeks' time, which we may not be able to control, and we may not know what that's looking like
Absolutely.
anyway. But I guess
Yes, that's right.
a sort of side point to that, I guess,
Yeah.
thinking about the notion of stress. And I guess we always think about stress as being a negative. But I guess in terms of if it's real concerns that you're stressing about, maybe stress isn't necessarily, we don't need to think about stress being a bad thing. More it's just thinking about things. I'm sort of thinking off the top of my head, but I'm sure you can formulate that into some better ideas than I just
you're
did.
spot on. I mean, we wouldn't do anything if we didn't have a certain level of stress in our life. And I guess the classic example is you know, you might be talking to a child about them being overwhelmed or stressed about a particular presentation they have to give. And we can talk about how a certain level of stress is actually good because it means that your presentation will be so much better. There'll be a little bit of adrenaline. You're going to use that stress to make sure you're well prepared for the presentation. It helps and it will bring you a better outcome in most cases to have a little bit of a stress associated. So I agree with you. I think stress is one that we like to try and ignore. So often if we've got a lot going on up here, it can be really noisy. And if we don't have a lot of control over the things that we're stressed about, we just keep telling ourselves, stop thinking about it, don't worry about it, I can't fix it anyway. And I think that we often miss a vital step in stress management when we do that. I understand people want to say, I'm not going to worry about it, I can't fix it. But there's the step before that, which is important, which is actually naming the stress. And I will often ask people to sit down and write a list, right? Get all of the noise from up here onto a piece of paper. And sometimes people are really hesitant to do that because they're going to bring their stresses into their conscious state and they're going to give it too much airtime and they feel that they're going to become overwhelmed by it. And my response to that is you're already feeling overwhelmed by it because it's running amok up here and it just keeps reminding you to think about it. Oh, remember we're stressed about this. Remember we're stressed about that. You know, keep thinking about it. Keep thinking about it.
Yep.
When if we write it down, it can be a little freeing. We can get it out onto the page and we can quickly assess what do we have control over and what do we not have control over.
Yep.
And the stress that we don't have control over, writing it down might mean that we're able to recognize that because we can see it in black and white and we can say, oh, that's right. I forgot that I didn't have control over the world economy. So maybe it shouldn't be me worrying about it today instead of watching this television show or being in the garden with the sun. So the little things that we do have control over, it's really worth getting them from up here onto a piece of paper because that might propel us into that next step, which is taking control of those little stresses or the daily hassles and doing something about them.
I guess that leads into the next sort of experience. And this was more of an experience that I think people were sharing. And it's sort of already come up quite a bit. So we may have already covered this in depth, but was the constant having to deal with the stress and anxiety of this unknown and uncertainty that's around at the moment.
Yep. And, you know, there's that whole idea that people with MS, we are experts in uncertainty. If you feel uncertain about something, come to the people with MS. We can tell you all about it because the day you're diagnosed with MS, you are given a ginormous lump of uncertainty on a platter. Here you are. Good luck with that, you know? And you just carry it out of the diagnosis and it's so invisible, but it's kind of right in you and it just sits there like a lump, I think, for most people sometimes for a long, long, long time, and sometimes for a little bit of time until it's kind of pushed down and buried, and then it comes back up when you're not expecting it. And uncertainty is a shocker. And so I think a lot of people are experiencing it. As you've said, people with MS are, I guess, experts in it. That doesn't mean it's easy to deal with more of it, you know, not at all. It might mean that that's the straw that breaks the camel's back in terms of, you know, I've had enough uncertainty. I don't need this as well. I was dealing with what I was thrown, you know, please no more. And people with MS can, and other chronic health conditions, other conditions generally, can feel really overwhelmed. I think that there's four main points that I would like to address around the uncertainty and the anxiety that have been coming up for people around coronavirus or COVID-19. And I take these 4 points from what's called ACT therapy, acceptance and commitment therapy. I love its full title. It's called an existential humanistic cognitive behavioral therapy. Just leave that there for a second. What a
Yep.
ridiculous sounding name. But it's a good one,
Someone's proud of it, I'm
because
sure.
it's a good one, isn't it? Yeah. It's basically a modern day version of cognitive behavioral therapy. And I like it because acceptance and commitment therapy, it's such a mouthful, is really good way to frame living with MS. It's really good for people with chronic health conditions. It's good for people when you know that there is no answer to be found. There is no cure for MS. This is something that people live with forever. It's a chronic condition. So to be able to try and find places where we can accept that reality and then commit to living a life of values and living a life where we can pay attention to things we can control and things that we can't, and go on and be rock stars anyway, is essentially this therapy. So acceptance and commitment therapy says that the first thing we should be doing is to really, as you and I have discussed, focus on what is within your control. And that's very hard at the moment because we are all having a million thoughts and feelings about our MS, about our personal situation, about coronavirus, about being isolated, about our loved ones, all of these things, about world politics or world economies. And our thoughts and feelings are strong, and we might not be paying too much attention to our behavior, but our behavior is super easy mostly to take control over. Thoughts and feelings, we don't have control over that. We really don't. We don't have control over what thoughts are going to pop into our head. If we've just sat down and turned on the news and see something catastrophic, we can try and trick ourselves into thinking we have control over our thoughts, but we don't. So they will come and go, and we have emotions that come and go, but we can actually invest in our behavior. So taking control of what is within our control is an important thing to do. And I think the secret there lies with focusing on what's in front of you and being in the moment and choosing the behavior that we want to engage in here. So the next point is to focus on what we control and then notice our thoughts and feelings. So just like before with the stress, we don't want to skip a point. We don't want to say, that's right, there's no point worrying about it. Let's just dig in the garden. Because we're focusing on digging in the garden, which is great, but it's because we're having really uncomfortable thoughts and feelings. And it's important for us to acknowledge them. It's very uncomfortable. It's uncomfortable to have them. It's uncomfortable to acknowledge them, but it makes them pass more quickly if we can say out loud, if you like. I mean, my children hear me talking out loud to myself all the time. Maybe it's an age thing. Maybe I'm a little bit nuts, but it's actually okay to say, gee, I'm feeling a bit sad today, or I'm feeling a little frustrated, or I'm feeling overwhelmed. And just to have a moment, you don't have to say it out loud, just to have a moment within yourself to recognize and acknowledge and accept those thoughts and feelings, to be curious about our thoughts and feelings. And I noticed in those few weeks that were really problematic, late March, early April, I was noticing that a lot of people around me, not simply clients, not myself, not like everybody, was reporting to me that they would have 2 or 3 days where they were like, wow, this is a whole new world, but I've got this, it'll be fine. And then a moment in the supermarket where they find themselves tearing up, or the tears are streaming, or they're feeling overwhelmed because they heard something on the news, or just out of nowhere comes this wave of emotion that they weren't expecting. And there would be reports to me of, I really thought I was coping okay with it, but this isn't like, maybe I'm not coping. It's really important for us to just acknowledge our thoughts and feelings because they do come. We don't have a lot of control over them. So that's step number 2. And then step number 3, I have taken from a client who taught me this years and years ago. Ask yourself this question: where are your shoes? Or she actually said, where are your boots? Are your feet in your boots? And wherever your boots are, maybe you should be there too. And she was giving me this example of, if you're in the kitchen with your family cooking dinner, if you look down and you see that your shoes are there, then why is your head at your work meeting yesterday that didn't go so well? Look at where your shoes are, look at where your body is, and be in your body. And this can be a game changer for people if they're finding that their thoughts are 3 months from here. How am I going to get back to work? Will my job still be there? What does it mean for world economics? What happens if my friends get sick? No, have a look at where you're sitting, be in this space, attend to where you are. And a couple of the ways we can do that is to just do the simple breathing, making sure you can feel the breath come through your nostrils and into your body. It can help you get back into your shoes.
Yep.
And number 4 is to say, engage in what you're doing. So we talked about behavior before being much easier to control than thoughts or feelings.
Yep.
So we've gone through all of these 3 steps and we get to number 4, engage in what you're doing. The easiest way to do this is to have a look around and be aware of your senses. So I recently got some chickens. Can't recommend them highly enough. They're in my backyard. Just a little bit of information.
Yeah.
You revealed that you're a Blues supporter, so I think maybe I can talk about my chickens.
Yeah, definitely.
So thank you. So I'm in the chicken, like coronavirus is happening. I'm working from home. I'm homeschooling the kids. Like life is crazy different. But if I am in the little area that we've set up for the chickens, I can just be in that moment where my gumboots are. And I can remind myself to be in that moment by checking in with my senses. Mm-hmm. So this is a trick that lots of people use and they report really helpful. If you're having a moment, if you're feeling a bit overwhelmed, I think a great thing is to go outside with the chooks, but go outside wherever that is for you, on your balcony or into your backyard, and ask yourself, what are 5 things that I can see? Because when you are inside and you're worried, your world is this big. Really, it's all about what's up here and you're in a comfortable temperature and you're in your familiar surrounds. But if you get outside and you start asking yourself, what can I see? You're going to see things that might be a little bit surprising. Gee, those autumn leaves are gorgeous and I hadn't recognized them. Oh, I can see the chicken laying an egg. Not really. I can see that they need to fill up their water. I can see that the vine is creeping up the fence just like I intended it to. All of these things, and ask yourself, what are 3 things I can hear? Mm-hmm. And it's amazing that there will always be 3 things that you can hear, particularly if you're outside. And that will bring your mind back to a bigger, broader perspective, not so here and small and hard. Yep. What can you smell? Chickens, don't want to smell necessarily that, but you can be smelling other things in the garden. You can recognize either a smell or a taste that's in your mouth to bring you in line with your senses. And you can also think about, what am I doing? What am I touching? What am I feeling? I'm not going to be thinking and I'm not going to be feeling. What am I doing? And remind yourself, I am with my chickens. All I have to do is refill their water. That's what I'm engaged in now. And following these kind of 4 techniques can be really helpful to bring our mind just into check, acknowledge that we're going through a really hard time and thoughts and feelings are appropriate. But a way through is to just engage with what we're doing in our body. Yeah.
Really good advice, I think.
Thanks. And get some chickens. Chickens are just absolutely, they're so much better than I thought they'd be.
If you're watching this and you've gone out and bought some chickens off the back of this video, please send us a photo.
Please. Lock them up safe though, because we did have foxes eat all of our chickens once.
Oh no. Okay, let's move on.
Okay. We'll move on. That's a sad story.
I mean, I guess that a lot of the things that you're talking about there may relate to the next experience question that we got, which was, I guess, a sense of things really building up and isolation and stress building up.
Yep.
How in those times can I just feel calmer?
Yes. So I think I'm going to be annoying and say refer to the last question.
Yeah, I think that was.
But no. Well, there are some tricks to that as well, though. But I think it is to remind ourselves that it will pass. We have all been through hard times before, and they pass. They change. I mean, they may never completely go, but they morph and they change, and we will get fresh perspective on them. So we do have to remind ourselves that this will pass also. Mm-hmm. And then we can just, kick into the kindness drive. Be kind to yourself and maybe combine a couple of things, a little bit of productivity with a little bit of relaxation. Mm-hmm. So a little bit of productivity, it doesn't mean write a book. I'm seeing so much on social media about now I'm going to write my, first novel or something because I've got so much spare time. No. Be kind to yourself and watch a Netflix series. Don't watch Game of Thrones. Don't watch something dark. Channel 7 put on, Contagion the other night. And I started watching it. And then I was like, what am I doing? And I had to change the channel. Don't watch dark things if you're feeling a bit low or a bit anxious. Put on a movie that really you've enjoyed before because it gives you a little bit of a laugh. And it takes you somewhere else that's just a lighter, breezier place to be. So a little bit of escapism, a little bit of relaxation is fine. A little bit of productivity. Clean out the Tupperware drawer. It's boring, but you will give yourself a big pat on the back. Yes, I did something. I was productive. I did something that I was proud of today. It can be anything. But I think there may be ways that people can elicit a bit more calm.
Mhm. I think finding that balance is really difficult at the moment because your environment is not changing like it usually would. You can find yourself going to one of two ways with that, where you're trying to work all of the time because you feel like you're always in your
Yes,
workplace, or
true.
you feel like you're trying to relax all the time and you're doing nothing but watching Netflix because you're not in your workplace and
Yes.
you don't have that sort of, I guess, balance that you would
Yes,
normally try and
you've
achieve.
absolutely nailed it. You have to do both.
Mm.
And I think a lot of this is about being very conscious of acting with intent. Don't just slip into one or the other.
Yep.
Say, oh my gosh, I'm getting so much work done. This is so great. But is it? Or maybe you should keep your work hours.
Yep.
Because if you want to save yourself from going nuts, don't work 24/7, and certainly don't watch Netflix 24/7, because they're both slippery slopes to depression and anxiety. We have to work with intent to shape a reality that is healthy for us,
Yep.
not just easy. Yeah, healthy is not easy necessarily.
Yep.
Yeah.
Okay.
Yeah,
Very
absolutely.
similar.
Also, can I say,
Yeah.
oh, sorry, what were you
No,
going
no,
to say?
no. I was just going to say
Oh,
that that's very similar to, I mean, we have that assumption, or it comes very easily to us, that we think that when it comes to our physical health, that achieving good physical
yes.
health and being fit is not going to be easy.
Yeah,
But mental health, I guess, is something that we don't often think about in the same sort of way. But I think it's really
you're
important that
spot
you
on.
say that.
Yes, you are spot on. And then I should also include ways to feel calm, mindfulness apps.
Mm.
Look, and I'll just do like a 1 minute thing here about mindfulness apps. I used to suggest it to clients as, go away and do this, and it's 10 minutes a day and it'll make you feel calmer and it's really good. Give it a shot. And so many people were coming back saying, yeah, no, I don't think I'm that person. Like, I can't really switch my brain off. I'm too busy.
Yeah.
And then I realized I was not selling mindfulness apps appropriately. And really now how I sell it is to say to people, you will hate this. You won't enjoy it. It'll be the hardest thing you've ever done, because your mind is so noisy, and you have to do it. And you have to do it. You'll hate it, sweat it out for 3 weeks, and then you'll go, oh, this is actually quite good. I can actually see some benefit here. Because nobody wants to sit and do nothing for 10 minutes. Oh, it's excruciating, but it's something that it just has some long-term benefits. So if you want long-term calm, then get yourself a mindfulness app. Like Smiling Mind is one that I always say is a good one. It's Australian made. It's a quick one. It's easy. The guy's voice is really easy to listen to, in my opinion. But there are some other great ones. There's Calm, there's Headspace, there's one called Buddhify. There's a few. You can go onto the App Store and there's a million to choose from, but there are some of the ones that you can just give it a shot. If you've got spare time, give it a shot.
Okay.
Yep.
Fantastic.
Daily. It won't fix anything if you just do it once.
Similar to physical health again.
Exactly the same, and
Yep.
just as annoying.
I guess on a slightly different note, the next sort
Yep.
of experience that people shared, I guess, is this really polar opposites of, should I be sharing and opening up with people all the time and really talking about everything that I'm feeling and going through, versus is it better if I just hold it all in, bury my head in the sand and keep it within myself?
Yep.
What are your thoughts on that? What can you
Yes.
tell us about that?
Yeah. Well, we can't give anybody prizes for guessing what the psychologist in the room is going to say. I think it's really important to talk about things, but as you reflect, why would you talk about something if the person you're talking to is not going to be able to fix it? Is often the approach used by people to just bury it down. I'm not going to talk about how I feel because they can't fix it, so I'm not going to lump it on them, or I'm just going to look like an idiot. I'm sure I can deal with it myself. They're all understandable thoughts and feelings to have with uncomfortable feelings or uncomfortable thoughts. But in fact, research tells us that just talking about things can give you a bit of perspective. It can be beneficial to get it out. Particularly if you're talking to someone who is not going to attempt to fix it, if you're talking to someone who just asks a good question every now and then, if you're able to find somebody who might have a shared experience. So for example, if you're finding it really frustrating or difficult to manage work and in supporting your kids because they're learning from home, And I use that term rather than homeschooling because I am not a teacher and I cannot teach my children, but I can support them to learn from home. But it's confronting and difficult. And so if you're finding that is really wearing you down, then the benefit might be in talking to somebody else who might also be working and schooling their kids or helping their kids learn from home. Just as we know, the research around peer support for people with multiple sclerosis is so valuable. If you can talk about your experience with somebody else who gets it, with somebody else who might have experienced some of the symptoms that you have, or the diagnosis that you have, just something that connects you, that can be tremendously beneficial. So I would suggest that everybody look at, what are my worries and concerns at the moment? Am I sharing it with the right people? If you're going nuts because you're sharing a house with your partner and they're driving you crazy because of their little things that are annoying you and you're 24/7 with them, don't talk to them about it. Maybe talk to somebody else who is also being driven nuts by their partner, who they love very much but is too much in their space. That can be a good place to share, to find somebody that has a shared experience.
And I think, it's also sometimes that you don't realize that the person is having a shared experience. And so for the person that you're talking to, isolation has been a huge thing that we've talked about today. They may be going, well, I'm not going to be talking about it because I don't, no one's going to understand this. But then when you do, someone goes, well, I'm not alone. And
That's right. Yeah.
You have that as well. Yeah. I think an important thing that you mentioned, just touched on there, but I'd be interested in hearing just a little bit more about, it's not just in terms of the people talking, but the people listening. And I think one of the big things you said there was that you need to find someone who's not necessarily going to fix it. And I think that's a lot of us, and I hand up, I am a person as well.
Me too.
As soon as someone says something, I'm like, okay, here's plan A, B, and C as to how we're going to deal with that.
Here's the solution.
And you don't necessarily need that, but as listeners, that may be difficult. And I guess a lot of people watching this may be, in that boat of being a support network or a carer or someone whose role is to listen. What sort of things as listeners should we be trying to do more of?
Yeah, great question. I think really effective listening is about holding space for that person, just sitting and being present. Walking from room to room is not okay. We've all been there before, where we start talking and somebody continues whatever they were doing and you think, oh, I don't know if they're actually paying me the attention that I feel like I need around this topic. So sitting with somebody and just being physically present and open to what they have to say is great. And acknowledging what they're saying. So lots of this is basic active listening, I guess. Just listening and being interested. I think that's the biggest thing, being interested in what this person has to say and asking questions about how they feel about their story. I was so hesitant as a psychologist when I first started working with people one-on-one, that I was so aware that every now and then the question would come out of my mouth of, so how do you feel about that? Which is the ridiculous question that psychologists ask, and we get canned for it all the time, but it's a legitimate question. And I love it when I ask it and the person in front of me answers in a way that is completely unexpected. Somebody says to me, it was a really crude example. Somebody says, it was my birthday last week. And I said once, when I was a Lifeline volunteer, actually, I said, oh, happy birthday. That's not the right thing to say if you're a Lifeline counsellor. And somebody is called to say, it was my birthday last week. No. Now I would say, so how was that? How was your birthday? Because sometimes the answer is, it was the worst day of my life. Or it was not what I expected or wanted. So the person listening really does much better if they're just curious about the person's story and what they want to talk about. Just be curious about it and ask questions to help that person talk about it.
I guess sometimes that the actual resolution and solution is actually just the act of getting it out there and talking about it. There doesn't need to be
all the time
actual problem that needs to be solved beyond that, which as listeners, I think maybe we need to learn.
Yes, sure. Yeah.
So I guess, and actually this is something that you touched upon a little bit at the start or earlier in the discussion when you talked about how, living with uncertainty is what people with MS are great at, because that is their reality. One of the really interesting things that we've seen a bit online, especially throughout all of this process, is, well, for, I guess, the broader, population, everyone's really struggling with isolation, not being able to go out whenever they want, not being able to see whoever they want, go out to restaurants, etc. But there's been a lot of sort of stories of people sharing their experience from people living with MS saying, we get that this is really tough for you, and we wish you weren't having to go through this, but welcome to our world. This is actually our reality, not just around coronavirus. And I think that that's, for us, a really interesting and powerful thing that we need to be made aware of.
Yes.
But, what are your thoughts from your perspective on that sort of idea?
Yeah, I was equally fascinated, actually, that several of the people that I'm working with who are highly anxious individuals were reporting in those really full-on weeks a lowered level of anxiety, and they were pinning it mostly to the fact that they were seeing other people in their world dealing with similar levels of social isolation and similar levels of difficulty getting out and about, and restrictions being in place, and they were feeling, I don't know whether it was a sense of camaraderie, but certainly, other people get it now, and it was combined actually with another thing that was happening with them, which was a reduction in need to be everywhere. Their appointments were being reduced. They didn't have to be, here by a certain time or there, and they were finding that liberating as well. So there was this funny interplay between, now you people get what it's like to live in my world, as well as a reduction in pressure that they were putting on themselves internally, or external pressures of having to be at particular appointments or even at work every day and back and forth. That was making life a little bit easier there in the first little while for some. I have to make the point, though, as we make over and over, it is such an individual game living in this age and living with MS. Everybody's very different. So there are threads of this that maybe some of the people watching are saying, oh yeah, I was definitely like that, or that wasn't me at all. I'm a little bit concerned, and I'm sure a lot of people with MS agree with me, that the population now might know a little bit of what it's like to be in the world of MS, where life is reduced, but life will reopen more for everybody at some point. We keep saying we will get there, we will get through this. We don't know whether we'll go back to normal, but we will get through this difficulty and this social isolation moment. And people with MS presumably will get back to their normal, but their normal is not the normal of the people around them that will go back to, huge social lives again. So I think that we're all in for a rough and rocky road. We're all on it at the moment. And I think we have to be mindful that the world will open up again, and people with MS may yet again feel that grief of them having that isolation remain to a certain level. So we should all be aware of it, but also people with MS maybe need to spend a moment thinking, yes, that might be a bit hard to deal with when that happens. How am I going to circumvent it? How am I going to make sure that I'm putting into place now good mental health strategies for when everyone goes back to normal, and gives me the impression that I should be feeling fine and dandy now when maybe I won't be.
Yeah, and I think that that's a hugely important point, that obviously we've scheduled this Q&A and we're talking about this in terms of what's happening with our mental health and how do we manage mental health during this period. Yes. But actually the shift out of this period for some people may be even more difficult from a mental health perspective than it is now. And so it's, it's a journey.
It is a journey. And I think that's across both people with MS and everybody else as well. I'm hearing, and you might be hearing or experiencing, Brett, that idea of, working from home is actually quite enjoy this working from home. Yep. I also hear from a couple of people with MS saying, I'm feeling a little bit guilty about how much I'm enjoying the world slowing right down. Yep. And everybody is we're all in different boats, but it's kind of a similar boat. So we're all in the same boat of not being able to go anywhere, and I'm enjoying the bubble that we're in. And maybe in Australia, we're heading into winter and we're just going to get into this cozy kind of hibernation feel. And I do worry about everybody, not just people with MS. Yep. And the expectations they put on themselves to snap back to what was, when maybe they actually don't want to snap back to that. Yep. And there might be some resistance internally and externally from people not wanting to go back to how it was.
Yeah.
So it will be an interesting space to watch, I think, how we manage those psychological pressures.
Yeah, and I mean, I think to keep our analogy going of how this relates to physical health, it's the same sort of way as, in late spring, how we all start to think, oh, we need to, go out for a lot more runs to get our beach bodies right.
Yeah.
When realistically, physical health is something that we need to be doing, 12 months of the year. And in the same way, we're talking about mental health because of some really crazy circumstances that are going on at the moment. But it's again something that we need to be focusing on all the time.
All the time. And I think my approach to resilience is for that reason. If we can build lots of resilience promoting activities into our life now, last year, next year, because there will be challenges coming from every angle, because that's what it's like to be alive. It's not necessarily an MS challenge. It's not necessarily got anything to do with the coronavirus, but we will be facing challenges because we're human beings. And why wouldn't we actively build our resilience now, from today, from tomorrow, from last year, so that when a challenge is thrown at us, we will be able to weather that storm, Yeah.
I guess that another point that we had raised was, this idea of feeling like there's no escape at the moment. That there's this feeling of loneliness and isolation is not going to end, and there's no way to get out of it.
Yes, and that's very real for a lot of people pre-coronavirus. If you are struggling with MS and you're feeling very lonely and isolated on the best of days, you're really feeling it now. And for the general community, a lot of people have really been bowled over by anxiety or sadness or worry or depression of these four walls closing in and there not being an escape. And I think it's a horrible feeling. And it can be a really, really paralyzing feeling. That sense of loneliness and nobody's watching me and there is no one to be accountable to as well can really compound things and stop us doing things that are good for us. They can stop us from being productive, and they can stop us from writing the stress down or writing a list so we can tick boxes and feel productive. So a lot of it, even though as I say it, Brett, I feel really harsh, but a lot of climbing out of that lonely place is up to us as individuals to say, what small thing can I do today to lift myself even a fraction? Is there something that I can do to plan for a better day tomorrow? And one of the most underrated techniques, I think, is to not try and find something that is of a particular joy for you, but to turn it around and say, how can I increase somebody else's experience in life? So and I've suggested this to a few people or worked with a few people on this, and I've found some fantastic results of saying to somebody who's just feeling like just low, what's the point? They're just existing. They're not thriving at all. The idea that they might have a few people in their life who are a little distant from them, they haven't seen them for a while, who might also be feeling this way. Can you think of anybody in your life that might also be feeling a little lonely, a little isolated, a little down? Mostly, we can think of somebody. And if you think of that one person, then why don't you take it upon yourself to give them a call? Now, if you're feeling really mentally well and robust in your mental health, that's not a hard thing to do, to pick up the phone and say hello to someone. But if you're feeling very low and down, it's a huge ask to pick up the phone, call someone else and muster some kind of conversation. It's really difficult. So I talk to people about having a little plan and saying, I'm going to call this person who I know is living by themselves and they might be feeling a bit lonely. But instead of just picking up the phone and making that, hard, pressing the buttons and calling them with nothing to say, back yourself and jot down a few conversation starters. And it might be, think of a story that you have to tell them about your own life. Think of anything. And people that are feeling lonely and isolated will say to me, I have nothing to say, nothing. So we will talk about the last thing they watched on TV. We will find some interesting anecdote that happened in the shop the other day. It doesn't have to be grandiose. It's just some conversation point, and combine it with 3 questions to ask the person that you're calling. How are your grandchildren is a great one if that person has grandchildren. How, have you been to the shops recently? What did you think of the changed environment? How do you feel when you see people wearing masks, or are you wearing masks? It can be anything, any question. And it can help you have a conversation flow to make you feel less uncomfortable. And I can almost guarantee that you get off the phone and you feel like you've connected with someone. That person might say, hey, thanks for the call. And you say, that's okay. I just thought that you might be feeling lonely, or it might be nice to touch base. Or even, I've been thinking about you recently, haven't spoken to you for ages. And you know that once you hang up that phone, that person has just felt like somebody cares.
Mm-hmm.
And that feeling makes us feel a little bit better about ourselves. So if we focus outwardly and try to instill a little bit of joy for somebody else, sometimes that can actually raise our levels of happiness or calm or satisfaction that we're okay.
Yeah. Okay.
Yeah.
Excellent. So,
Yeah.
I mean, there's been a huge number of helpful tips throughout this that I think are, really going to help people who may be feeling this way through all of this and beyond this, as we've said.
Yeah.
I guess for people who might be watching, who think, all of this is great, but I may want some more formalized support.
Yes.
What suggestions would you give them for how they should go about doing that?
Yes, that's a good suggestion. And I think the best message I can send with this is that it's never a bad time to talk to someone about what you're thinking or how you're feeling. And of course, the psychologist is going to say that. But I want to make the point that you don't have to be mentally ill to get a referral to a psychologist. I think sometimes people are really hesitant. Well, I'm sad, but I'm not depressed. I'm not clinically depressed. So if I tell my doctor I want to see a psychologist, then they're going to think that maybe they're going to put me in a mental institution. Like, people have these crazy ideas of what you need to be to see a psychologist. But really, I think seeing a psychologist should be around just having some space where you can talk about your thoughts, feelings, or behavior and get some clarity, a little bit of support, somebody who's not your cousin that's going to bring up something uncomfortable over a barbecue. You don't have to worry about somebody bringing it up at an inappropriate time. You can just get your thoughts and feelings out. So, to your question, there's lots of ways that people with MS can access psychological support. I guess the most straightforward path would be through their GP. They can get what's called a mental health care plan. That mental health care plan, they do need a referral from a GP, but the mental health care plan can be used with a psychologist of their choice. The GP might be the person who knows of a great psychologist, or you might have a friend that says that they've seen a great psychologist. So a word of mouth is good. If you've heard of a good psychologist, then maybe give them a call and see if there's a vibe. See if you feel like there's a rapport. If there's no rapport with that person on the phone, don't pay money to see them. You really want to suss them out before that first session, because psychologists are expensive. Medicare will give a rebate, but most psychologists charge a gap fee as well. So it's important to ask the psychologist on the phone before you turn up at their office or Zoom how much they're going to charge you, so that there are no surprises. You can also access psychological support through the NDIS. And there's no gap fee there, which is a real winner from the NDIS. But there are ways that you can have psychology in your plan. I don't know if am I allowed to give you my website, Brett? It's just sallyshaw.com.au. And the business I run is called Focused Health Psychology. And so that's not necessarily about accessing me as a psychologist, not at all, but in terms of accessing an information sheet that talks about how you can go about getting a mental health care plan, and you can print it out and take it to your GP, because there's so many big terms and so many different things, different words. And if you hand that to the GP will know exactly what you're talking about. And you can be referred to any psychologist in your area. And there's information about the NDIS there as well, and how to get psychology into your plan. I should also say that Lifeline are a tremendous resource. You might just want to talk something out, and Lifeline are there to talk to for an hour or for 15 minutes as a one-off. And their number, I believe, is 13 11 14. But there's also other great lines. Beyond Blue have amazing resources specifically around COVID-19. If you're feeling the social isolation because of that, they've just released a whole new resource there as well. So many things you can do.
Okay. I mean, this is coming to the end of it. I mean, this has been an amazing resource. One, let me say, getting to have been involved in this discussion, you know, so much useful information for a community that's really crying out for this information at the moment. So I think what you've provided today and given up the time to do is invaluable. So I can't thank you enough for that. Final thoughts from you, I guess, to people who might be watching.
I think in terms of mental health, I could just repeat the whole thing, couldn't I? And you know I can because of the amount that I talk. But I'd say the two biggest things would be really just have a think, what do I have control over now? And then engage in that. And, you know, get some chickens. No, I shouldn't have said that bit. Just engage in what you're doing now and know that being in the moment in a time like this is so much better for our mental health than being catastrophic with our thoughts and feelings about what may or may not come.
Okay. As I say, I mean, once again, it has been a huge pleasure to be able to do this Q&A today. Thank you so much for giving up your time, especially when you talk
My
about,
pleasure.
Especially when we talk about needing to separate weekdays and weekends, and you've done this on a Sunday.
Oh no, that's okay. That's okay.
But as I said, we're really grateful for you doing this. I know our community are really looking forward to watching it, but are also hugely appreciative for everything that you do. So thank you very much for your time today.
Thanks so much, Brett.
Thanks.